全般にいろんなことをお話しして、質問にお答えするような格好で進めていきたいと思います。で、スライドがあるんでね、出てきたら川先生に一応説明していただいて、僕が日本語でそれを追加補足するような格好でいきますけども、各セクションごとに質問が出てくるんで、多分皆さんが前もって提出された質問もあるのかなと思うんですけども、それに答えていきたいと思います。それで、どんな質問でもいいので、話した内容に関係したことでももちろんいいですし、関係ないことでもいいですから、気になさらずに挙手して言っていただければ、もしマイクが届かないようなことがあれば、僕は質問を繰り返して皆さんに聞こえるようにもう一回繰り返しますから、遠慮なさらずに質問してください。いいですか。ではそれとですね私カナダに来てもう26年27年経つんで、最近のその日本の、大体のことは分かるんですけど、細かいユーザーフィーのこととかなんとかのその仕組みがっていうか、細かいところがちょっとあんまり分からないんで、その辺のところは皆さんの方がお詳しいかと思うんで、いろいろ日本の制度とカナダの制度を比較するようなところも出てくるんで、そういう時はもし何か僕間違ったこと言ったら訂正してください。お願いします。じゃあ早速いきたいと思います。ではまずOHIPから。
Okay, so おはようございます。The OHIP plan is paid for by personal and business taxes, and it's sponsored by the government, and it covers all basic and emergency medical services that are delivered usually by doctors. It's 90 to 95% of the population is covered by this one plan. Okay, so who can apply for OHIP? Who is eligible to getting OHIP? So first of all, you have to meet 3 criteria. Number 1, you have to live in Ontario. You have to be in Ontario more than 153 days out of the year, and you can't be out of Ontario for more than 30 of your first 183 days.
OHIP 持ってらっしゃる方どのくらいいらっしゃいます？ It's about 40%. じゃあ残りの方は今申請中ということで考えてよろしいですか？いや。
So as soon as your residence in Ontario begins, that's when you should apply for OHIP if you'd like to be covered. I'm assuming everybody in the room will qualify because you live here and you have an immigration status that makes you eligible for it. So as soon as your residence begins, you should go to the Service Ontario office. Now everybody over the age of 15 and a half years old has to go there in person to apply. There is a form there that, or you can get online, or there's a form there that you can fill out. And you need to bring your proof of identification that has your name and a signature, proof that you're living here, and your proof of immigration status. And then the most important thing to understand is that once you apply, there's a 3-month waiting period.
OHIP の申請に関してはもう皆さんご存知だと思いますけども、3ヶ月の待機期間で、これに関する質問が後で出てくるんで、そこでまた議論しますけど、それだけの待機する期間があるんだけども、15歳以上の方は、自分本人がサービスオンタリオのオフィスに行って申請の手続きをしないといけないということで、どうぞ。
ですね、私の家族は、トロント来て1ヶ月になるんですけど、でサービスオンタリオの方のオフィスに行きまして、でそのOHIP申請したいっていう相談をしたらですね、 カナダに入国してから3ヶ月経ってから申請しに来いって言われて、申請はできないって言われたんですけど、それは正しいですか？
ご本人はもう OHIP 持ってらっしゃる。
私は持ってます。はい。
So he has an OHIP. His family members arrived a month ago, but they have to wait for 3 months to apply.
Yeah, so as soon as they get here, they should go to the Service Ontario office, and from the date they apply, it's still 3 months. 3 months waiting period.
But he said he was told to wait for 3 months to apply. Is that correct?
I don't think, no. I think you go to apply as soon as your residence in Ontario begins. You shouldn't wait for 3 months to apply. You should go immediately as soon as the living in Ontario starts, and that's when you should apply because of that 3-month waiting period. Otherwise, there's going to be 6 months.
だからそれはどういう説明されたのかわかんないですけど、僕らの理解する範囲では来られてオンタリオで居住が始まった時にすぐ行って申請をしてそこから3ヶ月待って、OHIP が届くということで申請を3ヶ月待つということではないということですよね。
私もその理解なんですけど、受け付けられなかったので、どうしたらいいのかな。
私もすでに1年買ってまして、OHIP 持ってるんですけど、会社側からやはり先ほどあちらの方のように、滞在3ヶ月後に申請しないとダメと言われて、3ヶ月後に申請してから、また何ヶ月後待ちました。
申請するのに3ヶ月待ちなさいと言われたということですね。
ここに書いてある滞在、83日間、これってそういうことじゃないんですよ。ちょっとだからこの中でも同じようなケースの方もいらっしゃると思うんですけど。
So there are more than one person who was told to wait for 3 months to apply.
My information was that's the way it's always been. I think that we were told that as soon as the residence starts, you've got to go to the office and then apply, and then you wait for 3 months because it's not going to be processed immediately. It doesn't make any sense. I can double check on that and I can get back to you, but as far as I know, you're supposed to apply as soon as you get here. Otherwise, it's going to be a longer wait.
ちょっと戻ってから保護で調べてみますけども。
多分ですね、先生のおっしゃることが正しくて、というのも私の会社のローカルスタッフで外国から移民したスタッフいまして、で彼が言うには来たらすぐに申請は可能だって言ってたんですね。でだから私サービスオンタリオの方に相談に行ったんですけど、多分私が相談したサービスオンタリオのスタッフの理解が間違ってたと思うんですね。でちょっとこのセミナーのポイントからずれちゃうんですけど、そういったトラブルがあった場合どうやってそのサービスオンタリオのスタッフに正しい理解をしてもらうというか受け入れてもらえるのかなっていうのがすみません、ちょっと質問にここ出してなかったんですけど。
So he was saying that maybe the person officer in the Service Ontario misunderstood the policy or regulation. If that's the case, what options does he have? He can complain. He can.
Yeah, so he can file a complaint. There's a phone number that you can call to get information. I'm looking at the website now, and what it's saying is OHIP coverage becomes effective 3 months after the date that you establish residency in Ontario. The ministry strongly encourages new residents to purchase private health insurance in case they become ill during the OHIP waiting period, but I think they're wrong. I think you apply as soon as you get residence, as soon as you're living here.
Our case, we apply after arrive, immediately after arrive, and then we got it.
居住 習が始まったらアプリケーションを出して、そこから3ヶ月するのが理解なんで、多分そのサービスオンタリオの職員の方が誤解してるんじゃないかと思うんですけども、オプションとしてはその正式にコンプレイントをファイルするのが一番いいと思うんですけども、あとこちらでも一応ダブルチェックをしますから、あとその後、商工会通してもしあれだったら皆さんにご連絡するようにします。
ありがとうございます。Okay. So what to do about those first 3 months? So first 3 months after you apply, it's still possible to get sick. It's still possible that bad things could happen. It's very important that you get coverage, private coverage for your health care. And the reason is that if you go to a hospital, if you go to a doctor, you will not be covered otherwise. So private companies, private insurance, which are the same companies that give you coverage if you leave Ontario, they can cover you for those first 3 months. And we've listed 3 common ones. There are many, many different companies that offer this. And I believe it's not very expensive, but it's a good investment to make because you never know when bad things can happen.
まあそのOHIPがもらえるまでの間をカバーするのに、プライベートにインシュランス入るっていうのはもちろん、別に議論する余地のない選択だと思うんですけども、何か質問ありますか？ Okay. So there's a question.
Yep.
So there may be a special case.
So when I saw this question, I did double check, and I actually called OHIP yesterday to see what the story was. According to OHIP, there is no special cases. There are no special cases. Doesn't matter whether you're pregnant and about to deliver. Doesn't matter whether you have an ongoing medical problem. It's very firm. They're saying that they will not cover you within the first 3 months. And I think you should understand the idea behind this is to prevent medical tourism. So people who will come to Ontario just for the purpose of getting treatment and then leave. So they were I asked them several times, and they were very adamant that there is no such thing as special cases. 3 months is 3 months.
特例っていうのはないそうで、その3ヶ月っていうのはそのメディカルトゥーリズムって、その医療、制度が整ってないところから来て、オンタリオでそのオンタリオ州民の税金で賄われている制度を使って医療を受けて、また母国へ帰るというようなことになったら困るっていう、そういう面もあって3ヶ月の待機があって、それに特例はないと昨日川先生がOHIPに電話したらそういうことだったんだそうですけども。何か皆さん違う情報を持っておられる方いらっしゃるかもしれないので、もしディスカッションがあればどうぞお願いします。どうですか？はい、どうぞ。
すみません、実は私3ヶ月以内に出産、アンエクスペクティブに出産してしまったんですけれど、その時に病院とOHIPの方に言われたのは、すでにOHIPをアプライしている人がトランザクションレコードで紙がもらえるので、その人用のレートが適用されてすごく安いんですね。でもしOHIPまだアプライもしてなかったりとか、OHIPに適用しない人だとすごく高いレートを適用されるので、必ず3ヶ月以内についたらすぐにOHIPを申し込むように、病院の方からも、あとサービスモニタリオの方からもアドバイスを
いろいろ勉強になりますね。She was pregnant, but she delivered within that 3-month period, but she had already applied for the OHIP, so she got a specially discounted rate.
So look, I work in I also work in the operating room at the hospital, and all the time, well, not all the time, but very frequently, we'll get visitors and students and people that don't have coverage that get appendicitis or have emergency surgery. And so I'll tell you right now, so as the doctors, they submit a bill to the patient. If we get paid, we get paid. If we don't, we're not going to put the appendix back in. So you know, and the hospital's in the same position. If you have to go into the hospital and you don't have any insurance, they're not going to hold you hostage. They may make an arrangement with you. They may make a deal. But the point is, OHIP will not be the ones that will pay for it.
プライベートのインシュランスは持ってらっしゃらなかったんですよね。おそらくですね、僕推測なんですよ。これ推測なんだけども、そのOHIPはねのポジションっていうのは変わらないと思うんだけど、病院がねカバーしたんじゃないかなと思う。そういう何か特別の病院の基金なり仕組みなりを持っててね。で川先生はもちろん外科もやられるんで、例えば盲腸の人だとかそういう3ヶ月の期間に来られる方がいてね、もちろんカバーしてないしそんなに高額のお金払えないんだけども、だからといって何かその特別なことを病院側がするわけじゃな特別っていうのは手を抜いたりとかそんなことはもちろんしないわけで、とにかく患者さんに一番いい医療は受けられるんだけども、なんて言ったらいいかな、本当は払わないといけないんだけども払わなかったからなんか悪いことが起きるとそういうことではない。They don't have any consequences if they don't pay.
That's up to the hospital. That's up to the hospital and up to the doctors.
だからもし払わなかったらどうなるかっていうと、それは患者さんとその施設の間の問題になると思うんで、そこに病院によっては何かそういう仕組みがあってね、少しカバーするような学校になってるところもあるだろうし、あまり追求しないでいいやっていうようなオフィスもあるのではないかなというふうに思いますけども、OHIPっていうのはここにあってね、そこの下に病院なり施設がこうあって患者さんがいて、そこでやり取りがあるわけで、ここをどういうふうにするかっていうのはひょっとしたら施設やお医者さんによって違うのかもしれないですね。
I should mention in 30 years of practicing in my office and in the hospital, I've never seen a patient refuse medical care. Every patient, whether they have OHIP, private insurance or nothing, will get very good medical care. But how it's paid for and how aggressive the hospital or the doctor will be at trying to get that money, that's up to the individual hospital and the doctor.
今僕が説明した通りで、その患者さんの一番の医療を受けられる保険があるなしにかかわらずね、それはもう原則にあってですね、そのお金を回収するのか回収できるのか病院側がね、それはもう個々の事例にもよるだろうし、いろんなサーカムスタンスがあると思うので一概には言えないけども、それはその州が何か全体的に管理してこうしろって言ってるわけじゃなくて、それはもう個々の病院と患者さんとの間の関係ということになるのかなというふうに思いますけど。
But you should know that the cost of a hospital stay is more than $1,000 a day. That's not including the doctors. So it gets to be very expensive, and the cost of the private insurance is so minimal that for 3 months it's definitely worth it.
医療費だったらただなんでわからないけども、病院に1日ステイするだけで、$1,000以上のただいるだけでね、それだけのコストがかかってるんで、その3ヶ月の期間、こうはいろいろ今まで議論しましたけども、プライベートインシュランスでプレミアム払うのはもうそれに比べたらビビたるものなんで、コストパフォーマンスとしてはいいというのが我々の意見ですけども、実際にそういう保険がなくてなんか病気になっちゃってっていうような時にも、それは医療が受けられないということではないということは覚えておいていいかなと思います。他に何かありませんか？
Okay, so what's covered by OHIP? So OHIP covers all basic and emergency medical services if they're delivered by doctors. There are other things that are either not covered or partially covered. For example, dental care, dental surgery, tooth extractions are only covered if they're provided in the hospital. If it's outside the hospital, OHIP has nothing to do with it.
歯科医療なんかでなんか手術するとかなんとかっていうのはOHIPでカバーされる場合は、それは病院で行われた場合ということです。そのデンティストのオフィスじゃなくて病院で行われる。
Podiatry, which is foot doctors. They're a special group. They're not doctors, but they have a special expertise and training. That's partially covered by OHIP. In other words, OHIP pays a certain amount for each visit, but the rest of it is up to, it has to be paid by the patient.
なんていうんですかね、足の治療、ポダイアトリストっていうのはお医者さんじゃないけども、OHIP がその治療の一部をカバーすると。
For physiotherapy, in Ontario there are two types of physiotherapy clinics. There are OHIP physiotherapy clinics and there are private physiotherapy clinics. Some of the private physiotherapy clinics also have an OHIP section, but you should understand that physiotherapy is only paid for if you're over 65, and then only at the OHIP type physiotherapy clinics. Everybody else either pays from their own pocket or by private insurance.
理学療法はその OHIP がカバーする理学療法の施設プラクティスとプライベートの理学療法っていうのがあって、いずれにしてもその65歳を超えなければ OHIP がカバーしないんで、あとはプライベートにインシュランスでカバーするしかないということです。
Eye examinations or optometrists, those are the eye specialists that get your glasses and do regular checkups. They're not eye surgeons, but they're optometrists. OHIP covers one eye exam for anybody under the age of 20 or over the age of 65, one eye exam per year. If you're between the ages of 20 and 65, you're not covered unless you have a diagnosis related to your eyes, like glaucoma, macular degeneration, diabetes.
検眼の場合はですね、19歳以下と66歳以上、高齢の方以外は年に1回は OHIP でカバーされるけども、その中間の20歳から65までの間っていうのは、何か基礎疾患が目に関連するような基礎疾患があって検眼する以外は OHIP でカバーされないので、プライベートのインシュランスでカバーするということです。
Psychotherapy, counseling, supportive therapy, emotional support is covered, but only if it's delivered by a doctor, either a family doctor or a family doctor that specializes in psychiatric problems, or a psychiatrist. Every other type of counselor, whether it's a psychologist, a social worker, nurse practitioner, counselor, not covered unless you have, again, unless you have private insurance through your business or something you personally paid for.
カウンセリングだとかサイコセラピーは OHIP がカバーする場合はメディカルドクターがそれを行う場合で、メディカルドクターじゃなくて例えば心理学の心理療法士の方だとかが行う場合はそれは OHIP はカバーしない。
Not all, but most laboratory testing is covered by OHIP. Most of the regular tests you'll get at your doctor's as part of a checkup or as part of an investigation is covered through OHIP. There are some tests that are not covered, and those are either new tests or tests that haven't been proven to be useful or extremely expensive, unusual tests, and those will not be covered. And the lab company, if your doctor wants those tests and thinks you need it, the lab company will charge you for doing those tests.
ほとんどの基本的な血液検査、臨床検査の類、心電図だとかね、は OHIP でカバーしますけども、中には OHIP のカバーがいってない、それでも重要な検査があることはあって、それがもしかかりつけの先生がそれを相談の上でオーダーしましょうということになった場合は、その行った先の検査のところの施設でそれは別に別途チャージされるので、then they can use private insurance if they want. もしプライベートインシュランスがあればそれでカバーするなり、なければそれ実費を払うなりっていう格好になるそうです。Can you tell us typical of those tests which were not covered?
So some of the common tests that you're more likely to get but not covered, for example, a PSA test for men to check for prostate cancer. very controversial test. A lot of people say we shouldn't be doing it at all. Some people say we should be doing it. It's usually for men over the age of 50. The government partially pays for that, and the lab company will charge you $30. Vitamin D levels, which are important for osteoporosis. Unless you have a reason why you can't absorb vitamin D, the government will not pay for that test at all. I think the test is about $50. The reason the government doesn't pay for that is that in Canada, we get such a small amount of sunshine during the course of the year that almost everybody in Canada, if you check their vitamin D levels, is deficient. So we say, if you think about it, everybody should be taking vitamin D. So they're saying there's no point in checking vitamin D levels unless you have a particular problem.
日本ではどうなのかよくわかんないんだけども、前立腺がんの、PSA のテストっていうのは非常に議論が多くて、要するに陽性である PSA is false positive.
A lot of false positives, a lot of false negatives.
Okay. 偽陽性っていうか、値が高くなってもがんじゃないのにガタガタ議論になって取っちゃうことになったり、あるいは見逃しがあったりということで、本当に価値があるのかっていうので議論になってて、OHIPは部分的にしかカバーしないと。だから家庭医の方と相談の上でもしテストを受けるとなれば、自分が$30払うことになると。だからビタミン D は、欠乏って言ったって日に当たらなければだから高緯度の地域に住んでる人っていうのはカナダだとか例えばヨーロッパの人なんかっていうのはビタミン D 当然測れば低いわけだ、アフリカにいる人に比べればね。で一体じゃあ意味があるのかどうかっていうことで、カバーしないと。どうしても何か調べたい、何かそういうビタミン D に関する病気のために調べたいっていうなら、それはあれなんですけど$50払わないといけないと。
All the childhood immunizations are covered. There are some new immunizations that have come out that are optional that aren't covered. And the important thing to understand also is any immunization and any medical care that you get that has to do with traveling. If you go into another country and you want to see your doctor about getting travel immunizations, that's not covered. As a matter of fact, the government usually says that the actual visit to see the doctor to talk about travel immunization shouldn't be covered either. That's up to the doctor.
予防接種はカバーすると。ただ海外旅行目的の予防接種はカバーしないと。で原則的には海外旅行に行くための過程でいろんなことの相談も本当はOHIPでカバーすべきではないということにはなってんだけども、それはそれぞれ個人のお医者さん患者さんの個々のお医者さんの裁量によるだろうということです。
Delivery for pregnancy, midwives for looking after a pregnancy, staying in the hospital, going to a rehabilitation hospital, all those things are covered. The hospital stay, I should mention, you have coverage under OHIP for a ward room. If you want a private room or a semi-private room, the hospital will charge you extra for that. And again, private insurance will cover it if that's important for you.
分娩はカバーする。助産師さんの手配もカバーしてくれる。入院もなんか特別な部屋でないときにカバーすると。リハビリテーションもカバーする。
Any sort of cast or splint that's again delivered in the hospital is also totally covered by OHIP. If it's something that happens outside the hospital, if the doctor tells you to go get a splint or go get a brace, that wouldn't be covered. So if you go to emergency, for example, and you have a broken arm and you need a cast or a splint put on the arm, that will be covered. If you go to your family doctor and you have a sprain, and they say, well, maybe you should have a splint to help heal, that you'll have to pay for yourself. So that's the difference between in the hospital or outside the hospital.
病院で処置を受けてギブスで骨を固定するとかいうのはカバーされるけれども、なんか軽い捻挫かなんかでオフィス行ってちょっと 添え木でも当てたらいいかな、いいんじゃないですかって言われて、自分でどっかで物を買ってこう添え木を当てるなんていうのは OHIP ではもちろんカバーしないので、それは自分でやらないといけない、そういうことです。いろいろ複雑だったけど何かご質問ありませんか？いや、OK。じゃあ次にOHIP でカバーされないものをもう一回。
So the things that OHIP definitely will not cover is cosmetics and cosmetic surgery. So if you go to the doctor to get Botox injections to get rid of wrinkles or lip fillers, or if you want to have a nose surgery to make your nose look different, or eyelid surgery, or breast implants, that will not be covered. However, breast reductions are almost always covered.
美容整形はもちろんカバーしない。ありとあらゆる美容整形はカバーしない。インプラントも、ブレストインプラントもカバーしない。ただ乳房のブレストリダクションって言って少し小さくする処置がありますけども、それはカバーするということです。
In order to be covered, sometimes if you go to a plastic surgeon and it's a question, they submit a request to OHIP saying why the surgery is medically necessary. For example, for breast reductions, can you do sore shoulders and sore back? And if your doctor can send that letter and proves that there's a medical reason to have a type of cosmetic surgery, then OHIP will pay for it.
もちろん何かの医学的な理由で美容整形が必要な場合は、それは個々の事例によって質問がOHIPに行って、カバーされるされないの判断が下されるということです。
For example, if there's a particular type of cosmetic surgery, if a child has very prominent ears, they will do surgery to pin the ears back, and that's deemed medically necessary because as the child enters school, they can be made fun of, so OHIP will pay for that.
例えば子供さんで耳がちょっと特別大きくて別に病気ではないんだけども、学校上がるにあたってね、何かそういう友達からのいろいろプレッシャーがあるかもしれないなんていうのは、美容整形の一部だけでもOHIPでカバーして矯正できるっていうようなことがあるそうです。
As I mentioned before, OHIP will not cover social work. It will not cover dietitians. However, there is a dietitian service run by the government where you can call in and speak to a dietitian or get information online, which we can talk about in a minute. Also, chiropractics, naturopathy, alternative medicine. So in other words, people that aren't physicians, that aren't doctors, OHIP will not pay for them.
ソーシャルワークだとかダイエティシャンによる栄養士さんによる指導なんかカバーしないんだけども、ガバメントが運営する栄養士のプログラムなんかはそれはもちろんそこでカバーしてくれるということです。
Family doctors, some family doctors will charge patients for if they have an appointment and the patient doesn't show up. That's not covered by OHIP, and if a doctor charges that, you'll have to pay for that. Also, some doctors charge what's called a block fee, and that is a yearly fee for things like writing notes and doing administrative things and filling out forms and making phone calls. So, in general, that's not covered by OHIP, and the patient has the option always of either paying a one-year set fee or paying a la carte, where you would be paying for each individual service.
ドクターのオフィスでアポイントを取った時のそのキャンセル料っていうのは、キャンセル料っていうのはノーショーというかアポイントを取ったんだけど行かなかったとかね、そういう場合のチャージっていうのはもちろんOHIPでカバーできないので、皆さんが決められた額をその個人個人の契約ということになりますから、お医者さんとで払うと。だから書類を作ったりなんだかんだももちろんOHIPでカバーしないので、それもお医者さんによるんだろうけども払わないといけないと。ファミリードクターによってはブロックフィーって言って、そのセットフィーっていうか1年いくらって言って全部その中に含めるのをやってる方もいるので、そういうので アレンジすることも可能であるということです。
If you take an ambulance, if you call for an ambulance, you call 911 for an emergency, and you get an ambulance to take you to the hospital, there is a nominal charge of $45. However, if when the ambulance comes, they say, well, you know, you called us for an ambulance because you have a, because you have a cold or a sore throat, they will charge you $240 if it's decided that calling the ambulance is unnecessary.
まあ救急車は45ドルかかりますけど、大した例えば風邪の症状なんかに呼んだりしたような場合は240ドルということになっているそうです。
Drugs in Ontario are not covered. So you go to your doctor gives you a prescription, tells you you need a medicine. Drugs are not covered unless you're over 65. And if you're over 65, there is a list of which drugs are covered, and it's about, I would say, 70 to 80% of the drugs that are out there. So most regular drugs are covered if you're over 65. If you have an especially low income, if you are out of a job and you don't have enough money, you can apply and the government will treat you as if you're over 65, will pay for those same drugs for you if you need them, if they're prescribed by a doctor.
薬はオリンピックでカバーしないので、皆さんの他の保険がカバーしないといけないと。で、65歳以上の場合は、高齢者の薬はカバーすると。ほとんどの薬はそのリストに入っているのでカバーできるということです。OHIP カバーできる、できないのことに関してご質問ありませんか？はい。
The list of the medicines covered. Can I get that list?
その OHIP でカバーされる65歳以上の方でカバーされるものの薬のリストは手に入るかということです。
I think so. We doctors, we get a binder that's this thick with the list of the medicines. I think you can check online whether it's covered under the Ontario Drug Benefit Plan, ODP. But to be honest with you, most doctors aren't even sure which ones are covered sometimes and which ones aren't. All the common antibiotics, blood pressure medications, heart medications, all of those are covered. But for the less common ones, the government decides whether it's a necessary drug, whether there's a cheaper alternative, and sometimes new drugs that are very expensive aren't covered. But in general, it's not a big problem. It's very uncommon that you can have a drug that's necessary that isn't covered if you're over 65.
だからほとんどの大事な薬はカバーされて、基本的なね、薬はカバーされているということですね。オンラインでチェックすることも可能です。
Okay. There is some rule that it covered first $100 covered or something. Are you going to cover that later on?
Yeah. So if you are over 65 and you're covered under the drug benefit program, there is a deductible, and there are two components to it. The first, I believe, is that there is a $100 deductible, where it means the first $100 of medicines during the course of the year you do have to pay for, and that again is done at the pharmacy level. And then there is also a prescription fee that I believe is never covered, and that's set by the pharmacy. I believe it's a very token amount, like $2 or $4, something like that. The exact numbers, I think also that the $100 deductible, that's negotiable. And I think sometimes if you're over 65 and you have low income, they can waive that $100 deductible. But I think at the pharmacy, there's like a $2 dispensing fee that happens even if you're covered by the drug plan.
よろしいですか？他にありませんか？どうぞ。
はい、すみません。自分じゃないんですけど、その駐在のお子さんで、今まだ日本にいるんですけど、これからこっ ちらに来るにあたって目の病気を持っていらっしゃる方がいらっしゃって、小学校1年生の方なんですけれども、その場合は、先ほどのご説明ですと大きく、県外の方に見てもらう1回は年1回はカバーされるということなんですけれども、2回目以降の場合というのは、それは患者さんご自身の負担になるという認識でよろしいでしょうか。
So he's a friend kid now in Japan, will be coming here, but he has some eye problem. I don't know what. I suspect the ophthalmologist has to take a look, but then if the optometrist is required, can he see optometrist more than once?
So for optometry, yes, if you have, well, first of all, if you have an ongoing medical eye problem, likely if you came to me as a family doctor, I would send this child right to an ophthalmologist who is a medical doctor, not an optometrist.
見眼視と眼科医っていうのは違うっていうのはお分かりになりますよね。
はい。
オプトメトリストっていうのは見眼視、眼鏡作る人ね。で、オプタルモロジストっていうのは眼科の先生ですから、手術したり、目の医学的な処置をしたりする人。その2つで、もしその目の病気っていうのは何だかよく分かんないけども、見眼視の処置なり検査が必要であれば、それは大ヒップで、of course, it would be covered by both.
Yeah, so an ophthalmologist, you can go as many times as you need to. There's no limit, there's no age limit. So if it's a medical problem, the ophthalmologist will see you. The under 20 over 65 doesn't apply. The one time a year doesn't apply. That's only for an optometrist. The optometrist is usually glasses and simple eye problems. If it's an ongoing, significant eye issue, I wouldn't even bother going to the optometrist. You go right to the ophthalmologist, and there's no limitations.
だから目のね病気が何であるから詳細はわからないんだけども、そんなになんか頻繁な何かモニターが必要だっていうことは多分見眼視の領域ではないんだろうと思うんですよね。だから眼科の先生に行くんで、もちろんそれはオーヒップの範囲であるっていうことになります。
Excuse me. Can I go to the optometrist for the glasses, and that is covered by OHIP? And at the same time, on a different day, can I go to the ophthalmologist?
Yes. So.
だから見眼視に見てもらうのと同時に別に眼科の先生に行ってもいいか、そういう話ですか。それもまあ必要があれば当然いいとは思うんですけども。
Yes, so they're not mutually exclusive. Very frequently, you go to your optometrist to get your eyes checked for glasses. The optometrist sees a problem when he examines you, and he himself can send you to the ophthalmologist. So there's lots of people who see the optometrist for their glasses and the ophthalmologist for their eye problems. And there's no connection. So you can see the optometrist for the glasses and the ophthalmologist you can see the next day or even the same day if you need to.
I have a case that the optometrist referred me to the ophthalmologist that he knows. Then my family doctor put me on ophthalmologist.
A different ophthalmologist.
Can I see two ophthalmologists and that's all covered up?
Yes. You want to repeat the question?
要するにまあ2人の違う眼科の先生に行く羽目になったということですね。どうしたらいいか。
One of the good things, as well as one of the bad things about OHIP, is there is no cost to the patient. There is very little responsibility to the patient. So if you see a doctor, a specialist, whatever, cardiologist, ophthalmologist, nephrologist, and he sees you, gives you a diagnosis, and starts treating, and you said, you know, I don't really like what he had to say, I don't really agree with what he said, or I don't like him. You could go back to your family doctor and say, I would like to see a second opinion. I would like to see a second doctor to see if he agrees or if it's or he disagrees. No cost to you. Government, OHIP still pays for it. There's no limitation on how many specialists you see, even the same type of specialists.
まあ要するにいろんなケースがあるんだろうとは思うんですけども、2人以上、まあ、何人でもその同じ専門のところの違う専門医にかかったってそれは全部OHIPはそういうことはあんまりモニターしないのでね、それはそういう事情があればそういうことになっても別に大きな患者さん側にとっては大きな支障がないっていうことですね。ただそれがいいかどうかはまた別の問題でしてね。
You should understand that OHIP is portable. You can go anywhere in Canada and they will accept OHIP for medical care the same as in Ontario. Actually, in Quebec, it's a little bit different. You have to fill out forms and you may have to pay and get the money back. But in general, anywhere in Canada, your OHIP card is good for medical coverage for the same things that it's good for in Ontario. But it's not valid outside of Canada. So, if you leave Canada, you should get private insurance because OHIP will not pay for any medical care. If you go to the United States, OHIP will only pay for the amount that service would have cost in Ontario, which is usually much, much, much less than the actual cost in the United States.
OHIP はカナダ国内であればどこでもどの州でも使えるか、まあ、ケベックなんかは最初に払ってなんか申請してお金戻してもらうなんかいろいろ手続きあるらしいですけども一応有効だと。国外はそうではないのでプライベートインシュランスを持ってた方がいいだと。
So for people who travel to the United States or other countries, it's very inexpensive to get travel insurance. Travel health insurance that will cover, in the United States it covers the difference between the OHIP cost and the actual cost. And in foreign countries, overseas, covers everything.
So for example, if they go to US, the emergency one OHIP might pay.
But if the cost of an emergency visit in the United States is $2,000, and then the cost of your
OHIP pays a little,
right,
and then you have to cover the rest with the private insurance.
Right. But for example, if my family drives to Buffalo to go shopping for a day, we take out travel insurance because it costs something like $5 or $6 a day. And if something happened, if I got in a car accident, if I broke my ankle, it could be thousands and thousands of dollars. So it's very inexpensive and it just doesn't make sense to take the chance, even leaving for the day, even not staying overnight.
OHIP あるなしにかかわらず、その旅行保険というのはあった方がいいであろうということですね。質問に行く前に何かここまで次の質問に行く前に何かここまででありますか？はい、どうぞ。
薬のカバーについてなんですけど、通常日本だと薬の薬剤負担の3割負担で全てがカバーされるかと思うんですけど、先ほどのご説明だと65歳以上の方でないと薬剤の負担については基本的にはプライベートのインシュランスを使わないといけないということでしょうか。例えば1型糖尿病の方とかですと若年期からインスリンの注射の後にかなり高額の薬剤負担が増えてきたと思うんですけども、そのあたりもすべてプライベートで治療するのカバーになるでしょうか。
So for example, the insulin for type 1 diabetes for young kids, it's not covered. It's covered though. The private insurance covers entirely.
Private insurance would cover it, but like any drug, it's not covered unless you're under 20. So for kids, it would be, it's not covered at all. If you're over 65, it's covered, or if you are low income and are getting your drugs paid for, it's covered, but otherwise you have to pay for it.
生活保護とかなんかの方だったらカバーすると。そうで高齢の方もカバーすると。そうでなかったら自分のインシュランスでカバーしないといけないので、持ってない場合はかなり高額になると思います。
遺伝的な要因でもともと小さい頃から病気にかかっているような方でも特例でカバーされることはないんでしょうか。
病院での医療、受ける医療以外は全てその自分のプライベートの保険で薬はカバーしないといけない。
Incidentally, by the way, a lot of people don't know this. Insulin, you don't need a prescription in Ontario to get insulin. You can just walk into the drugstore and get insulin. It's not, you don't need a prescription for it. One other thing I should mention, there is a special plan called the Trillium Health Plan. And the Trillium Health Plan is, covers all the same drugs that are approved under the Ontario Drug Benefit Plan for people who are over 65. But this is a program for people who have either very high drug costs because of a chronic illness or very low income or a combination of both. So for people where their drug costs would be too much of a hardship, there is a program that you can apply for called the Trillium Health Plan. You apply with a form that you get from the pharmacy, and if you're accepted, they will cover your medication even if you're not over 65.
65歳以上であればオンタリオドラッグベネフィットでそのほとんどの薬をカバーするけども、そうでない場合は高額になってきた場合はそのトリリウムのヘルスプランというのがあって、そこにそういう申請してカバーしてほしいということを申請して認められればカバーされると、高額のお薬だとねということです。どうですか？聞き残したことがあればまた後でいつでも質問してください。There's one question. Yeah.
So this question asks about charging for a visit to a doctor. I'm assuming a family doctor. There are no user fees in Ontario. In other words, you can go to your family doctor as often as you need to, even if you have a chronic medical problem or are there frequently. So you don't need insurance to cover those costs. We did mention the block fee before, which would cover, which means things like notes and filling out forms and phone calls and prescription refills. But otherwise, you don't need private insurance to help cover any sort of user fees for a family doctor.
So the background of this is in Japan, there is a user fee. 日本の病院に診療所にかかるときは個人負担って3割ですか？ 3割ですか？65歳でも1割。2割。でそれ以下だと、子供は自治体によって違うんだろうけども、大体3割。So most of municipalities between 18 to 65, they have to pay probably about 30%. And there is a ceiling. 上限があるんですよね。
上限は収入によってある一定の額を超えた場合には高額療養の制度があって負担が。
So depending on the income, there is a certain difference ceiling, and even at 65, they have to pay 10% of the. So that's the background of this. But then if they use a kind of special room or something, they have to pay from someone. So there's no such thing in the user fee? No. In the cancer specific insurance. じゃあ次の質問いきます。
So this question is, I guess I answered with that Trillium Health Plan. If you have a medical problem that involves a lot of expensive drugs, then you can apply to this program. And I think the program is such that if you apply for it and you're accepted, you pay a certain amount, which I think is 4% of your combined household income, net income, and that's what you pay for all your drugs, and that's it. So that's the only program that I know about. I mean, some people who don't qualify for the Trillium plan, who get refused, same thing, you can apply for private insurance where they would cover your drugs or costs of other medical needs.
そのユーザーフィーがないので、その日本とはまたちょっと事情が違うと思うんだけども、そのトリリウムのようなヘルスプランがあって、高額の薬に関してはそれに補助をもらうように申請するような、メカニズムもあるということですね。この点について何かもうちょっと詳しく聞きたいとか何か質問ありませんか？ What's that 4%? 4% of income?
If you qualify for the Trillium plan, it involves sending in your income tax forms. It involves you have to declare how much your family earns, and then they determine what your deductible is. So they'll say, okay, 4%, whatever that 4% of your income, you pay that amount, and when you've reached that amount in terms of paying for your drugs, then the government will pay the rest for the rest of the year.
要するに上限を決めるっていうことですね、そのインカムのレベルによって。So 4% is set.
Yeah, so 4% per year, and sorry, if they don't pay at the beginning of the year, it's split into quarters. So you pay 1% for each quarter. So you end up paying 4% of your entire income to pay for all your drugs for the year.
1% ずつに4四半期間1年間が分かれてて、それを超えたところをカバーするような学校になっていくということですね。それが上限になるんです。
Skip this one to the next page.
Oh.
Because we talked about just asking about telehealth and dentistry, which I talked about in the later slide.
この質問は最後、次のファミリードクターの中で出てくるので、そこでまたお話ししたいと思います。休憩？
それではですね、この後、ファミリー、ごめんなさい、クエスチョンもらえますか？よろしいですか？それではですね、次のセクションはファミリードクター制度に入ります前に、そうですね、10分、休憩を入れたいと思います。飲み物と外の方にございますので、こちらの方に出ていただいて、またご祝福と、またその間にですね、先生方に個別の質問があれば、ぜひしていただきたいと思います。それからですね、ファミリードクター、皆さん方非常にたくさんの疑問を、質問を持たれていると思います。先ほど申し上げましたようにですね、質問する際に前の方に来ていただいた方が便利なものですから、次回席を取られるときになるべく前の方に来ていただきました。特に質問のある方はよろしくお願いいたします。それではですね、15分に再開をいたします。よろしくお願いいたします。はい。
Yes. Yeah.
So the question is that, so basically, doctors is regulations covered.
Yes.
Anything which may not be covered in terms of the
So, essentially, different therapies. So, it's a problem because a lot of the therapies are not delivered by doctors, they're delivered by therapists, and so that would not be covered. So, this would be a good reason to have private insurance because OHIP will pay for drugs, they'll pay for doctor's visits, they'll pay for assessments, but in terms of some of the behavioral therapies, they won't pay for that.
薬の必要で、日本からその治療の情報です
I'm sorry, you're right. Yes, correct. Drugs will not be covered. Doctor's visits and assessments, those things will be covered. The drugs will not be correct. Unless you have private insurance.
Private insurance 種類によってね、どういうカバーするのか違うわけですね。薬はもちろん、どれもカバーすると、何でもカバーすると、行動療法だとか、心理療法だとか、わけわからない、いろいろある。それが効く、効かないわけです。別にしても、もしやりたいんであれば、その各プライベートインシュランスのプランが本当にカバーするのかどうかは、本人は知らない。
Let's go through visit and the any visit, any investigations are covered. So any screening tests, all those things are covered.
スクリーニング試験をアレンジしてもらえばかもしれないです。だから中にまず検査によっては例えば PSA みたいなお金じゃ払わないといけない。はっきり効果が分かっているようなもの。
Same way, stool testing, colonoscopy, any sort of screening testing.
歳以上でなければ、そうですよ。だから15歳以上であれば、ご本人が行かないといけない。それで出向かないといけないので、来てからまた行けると。そうですね。はい、15歳以上で出ますから。
はい、それではですね、次のテーマ、ファミリードクター制度の方に入らせていただきたいと思います。先ほど申し上げましたように、毎年ですね、その項にテーマになりますと、非常にたくさん質問が出てくるということで、おそらく皆さんも関心が高いと思いますので、先ほど申し上げましたように、ぜひ前の方に来てください。マイクを運ぶ時間がですね、それを節約できますので、よろしくお願いします。若干ですね、人をしております。皆さんの非常に質問が多いということで、効率よく進めたいと思いますので、ご協力のほどよろしくお願いいたします。はい、それでは先生方、よろしくお願いいたします。
Okay, so next we'll talk about how you get a family doctor. So first of all, what is a family doctor? Family doctor is the doctor you would go to for most of your medical problems, for regular preventative health care, for checkups. If you have a problem, he or she will be the one that would prescribe you for prescriptions if you need them. Also in Ontario, you cannot see a specialist under OHIP unless you have a referral from a family doctor. If you decide you have a heart problem and you want to go see a cardiologist, you can't do that. You have to go through a family doctor who does an assessment and then decides whether which type of specialist and how urgent it is that you should go. If you don't have OHIP, if you don't have a family doctor, there is the option of going to walk-in clinics. So walk-in clinics are clinics set up around the city or around the province that are staffed by family doctors, where you don't need an appointment and you can walk in. Still covered by OHIP because, as we said before, OHIP covers any medical care delivered by a doctor that's necessary. And the doctors at the walk-in clinics can send you to specialists if you need to, if they need to send you there. However, walk-in clinics will not do preventative care and they won't do won't do checkups, just routine checkups.
ファミリードクター制度の非常にベーシックなところですけども、ファミリードクターのいない方もいらっしゃると思うので、ウォーキングクリニックっていう手はあることはあるんだけども、そこではメンテナンスって言いますかね、チェックアップみたいなことはしないんで、非常に本当に何か本当になんかちょっとしたことしかしないんで、定期的に研修を受けるとかなんかっていう手続き、あるいは専門医の紹介が必要なんていう時はファミリードクターがあるのが一番いいとは思います。
So how do you get a family doctor? Well, not so easy. There are a lot of people who have trouble getting a family doctor because not every family doctor is taking new patients. You could be calling a doctor and saying, I'd like to become a patient. They'll say, sorry, he's full. So there are several ways you can find yourself a family doctor. The Ontario government has a program called Healthcare Connect, which we've put the website, sorry, we put the phone number up here somewhere, I think, or not? Is the phone number up here? Okay, so the phone number is in my notes. Anyhow, so there's a phone number we can give you. You can call between 9 and 5 on Monday to Friday, and they will connect you with a family doctor who is taking new patients. There is also an online connection for that, which we can also give you. It's here. Healthcare Connect is not CPS. Healthcare Connect is specifically for connecting patients with family doctors who are taking new patients.
ファミリードクターの探し方いろいろあると思うんですけども、ここに挙げたようなものがあって、電話番号も調べれば分かると思いますけども、1-800-445の1822で9時から5時でマンデーとフライデーっていう 1-800-445の1822だそうです。他にもいろんなやり方があると思います。
And if you look up Healthcare Connect on Google or the internet, there's also a way of connecting that way online. Other ways that you can get family doctors, most hospitals, especially the ones that are teaching hospitals downtown, they have a family practice unit. And the family practice unit is where they teach new doctors to be family doctors. And they're always looking for new patients. You would get to see a family doctor. Sometimes it'll be one of the supervisors, one of the staff doctors. Sometimes it will be a family doctor in training who's being supervised by an experienced doctor. Also, you could ask a lot of the walk-in clinics that are around the city. They carry a list of which doctors in the area are taking new patients. And finally, ask a friend. That's usually the best source. Find out who your friends go to, and if they're happy with that doctor, and then you can call that doctor's office.
まあ他にもいろいろな方法があって、知人に聞くっていうのも一番手っ取り早いかもしれないし、ダウンタウンの UOT のティーチングホスピタルなんかはファミリープラクティスのユニットがあって、そこは経験積んだスーパーバイザーの下で新しく卒業してきた家庭医の先生たちが修行しているようなユニットがあるんでね、そこ行って、先生を見つけるっていう手もあるか。マウントサイナイにしろ、サニーブルックハズ
So all the teaching hospitals, Sunnybrook, Mount Sinai, University Health Network, both the Toronto Western, Toronto General Branch, Women's College Hospital has it, North York General Hospital has it. Most of the hospitals have a family practice unit.
家庭医センターみたいなのがくっついてるんでね、そこでいろんな先生がいらっしゃるんで、そこ行って探すっていう、かかって探すっていう手もあるかなと思います。
There's also a website run by the College of Physicians and Surgeons. The website's down at the bottom of this slide. That lists every single doctor in Ontario, every single doctor licensed by Ontario, wherever they may live. It's not a great way of finding a doctor, but if you have a doctor and you need information, either an address or a phone number, that's a way of finding it.
カレッジ・オブ・フィジシャンズ・サージャンズ・オンタリオっていうのが、オンタリオ州の医師の免許のなんていうんですかね、母体になってるんですけども、そこで探すこともできる。あんまり効果的ではないかもしれないけど、そういう手もあるということです。
I should talk a little bit about walk-in clinics again. So, again, why get a family doctor? Why not just keep going to walk-in clinics? Well, there's a few reasons. Like I mentioned before, first of all, at a walk-in clinic, they will not do any preventative care. You will not be able to, they won't be booking mammograms, regular mammograms, doing regular pap smears for women. They won't be arranging either stool tests for screening for bowel cancer or colonoscopies. They won't do checkups. Also, you're not seeing the same doctor each time. The doctor won't know, you won't know your previous problems, won't know your health history. They tend to be younger doctors who haven't settled down yet and decided where they want to open up a practice. Since there's no appointments, you could go there and wait an hour or two before you were seen. On the one advantage is that you don't need an appointment. If your doctor is far away, or you just need to see somebody right now, and there's one right there, you can go see them. They have longer hours. Frequently, family doctors' offices will close at 5, although a lot of them are open in the evenings. Usually walk-in clinics have longer hours, so they can be more convenient. But you should understand that they don't fill all the needs of a patient in terms of preventative care.
ウォークインクリニックっていうのは手軽にかかれるということはメリットあるかもしれないけども、継続性がないし、検診なんかの定期的にアレンジしないといけないものはしないしっていうことですね。あとはここに書いてある通りです。
So the website at the bottom there tells you, they list all the walk-in clinics in Ontario. So if you're looking for a walk-in clinic close to you, that's where you go to find one. So there is such a thing in Ontario as a private health clinic. So this is it's a different sort of program. And these are some of them. There's Regal, there's Cleveland Clinics, Healthcare 365, there's also MedCan. So these are clinics that are not covered by OHIP. They provide preventative care, they provide regular health care outside of OHIP. If you're wondering why somebody would want to do this, well, these clinics are frequently given, a membership at these clinics is given frequently to executives at big businesses as sort of a perk. And you will go there once a year and they will do a complete checkup where they will do stress tests and ultrasounds and CAT scans. It's outside of OHIP, mostly because, in the opinion of OHIP and a lot of doctors, a lot of these tests that they do are not really medically necessary. But you should know that these places exist, and especially if you are employed as an executive at a large business, they may send you to these guys as part of your employment plan.
OHIP って公的医療の国、カナダは公的医療の国ですけども、プライベートクリニック、ここに挙げてるのはプライベートクリニックっていうのもあって、それはもちろん膨大な年会費を払って、大きな会社の重役なんかのベネフィットみたいなもんかもしれないけども、そういう実際にダウンタウンにこういうのがあってね、そこではもう、もちろんOHIPの範囲外で自分でお金払って検査を受けるわけですけども、いろんな人間ドックみたいなもんですかね、受けることが可能である。
One of the previous questions was asking about what do you do for healthcare if you are bedridden, if you're stuck in your bed, or you have a problem, you can't get out of your house, or whatever. So there are two places you can go to for help. First of all, Telehealth Ontario, which the number is up here. They offer medical information, health advice. It's staffed usually by nurses, 24 hours a day. They will tell you frequently whether it's a serious problem, what you could do to help, whether it's serious enough to say that you should go to an emergency department by ambulance, or whether you can leave it alone. Also, MedVisit up there is a private company where they employ family doctors who do house calls. Again, totally covered by OHIP. There's no charge for any of these things. And you can get a doctor to come to your house. Can't tell you whether it's going to be within 10 minutes or 3 hours, but if you need a house call and you want somebody to come to your house, you can call that number, and they'll usually be able to get you somebody that day to come to visit you at your house. I should also mention there is such a thing as a mental health hotline. It's a helpline also sponsored by the government for patients who have, or their families who have emotional or mental problems that they would want to talk to somebody about and get some counseling, totally covered by OHIP, and the number is up there on the slide.
先ほど遠隔医療の何かそういうサービスがあるかっていう質問を飛ばしたんですけども、ここで出てくるんで飛ばしたんですけども、このような実際に来てくれたり、往診してくれたり、電話で対応してくれたりするサービスはあると思います。Is there or there are many other similar services?
No, you're talking about the mental health hotline?
No, the remote.
So MedVisit. There are. See, the problem is because they're private businesses, sometimes they're closing down, sometimes they're opening. MedVisit's been around for 20 or 30 years. I don't even know if there are any other ones, but certainly that's the biggest one in Ontario.
But it's OHIP covered. 他にもあるかもしれないけど、このMedVisitっていうのは比較的歴史の長いものだということですね。ここからいくつか質問があります。
So most family doctors will do general health care and pediatrics. It's very rare to find a family doctor who doesn't do pediatrics. On top of that, some family doctors do have a special interest. Some, for example, have a special interest in doing counseling. Some would have a special interest in sports medicine. It's not that easy to find out. There is no central source to find out which family doctors have a special interest in which different problems. However, if it's something that the family doctor does almost exclusively, for example, there are family doctors who only do sports medicine or only do psychotherapy, they're usually associated with a clinic that is a sports medicine clinic or a psychotherapy clinic. So it's not really as important to know that in advance. If you have a sports medicine problem, your regular family doctor can send you to that sports medicine specialist. Same thing if you have you need psychotherapy, they can send you to the family doctor psychotherapist. But in terms of knowing whether your particular family doctor has any particular interest, it's hard to know. All you can do is ask whether they have any sort of special interests.
まあ、家庭医って一言で言ってももちろん人によってそのいろんな、まあ、得意分野って言ったらあれかもしれないけどその割とその専門的にやる分野がある場合があるんですよね。まあ、どの程度専門性があるかっていうのはまた人によって違うと思うんだけども、まあ、一般的なものは家庭医の基本的なその技量の中でカバーする、例えばベーシックな小児科のものだとかね、そういうことは家庭医という資格があるというだけでその技量を持ってるわけですけども、さらに深くトレーニングを受けてるいろんなところ違う専門分野でトレーニングを受けてる方がいるんですけども、それを、まあ、見つけ出すのはなかなか難しいというか、そのどっかウェブサイトに全部書いてあるかというとそういうわけでもないんで、自分で調べるしかないのと、まあ、聞くしかないっていうことですかね。でスポーツメディスンなんていうに特化してもともとは家庭医なんだけどもスポーツメディスンばっかりやってる人とか心理療法ばっかりやってる人なんていうのはいるかもしれないけども、そういう場合にはそのクリニック自体がそういう名前を持って表に出てることがあるんで、まあ、見つけやすいかもしれない、そういうことです。
So if you have an appointment with your family doctor, but you want to see the doctor earlier, for example, if your symptoms have gotten worse or you think that it's more urgent, yes, the answer is you call the receptionist, you say, look, this is what's going on, I need to see the doctor more quickly. If the receptionist says, no, you can't, well, I mean, maybe it's time to switch family doctors. You always have the option of going to a walk-in clinic. If the problem is severe enough, you can go to the emergency department or an urgent care clinic, which we'll talk about in just a minute. But look, I think that for a family doctor to be helpful, they have to be able to see you in a reasonable length of time. Now that may not mean that particular morning or afternoon, but certainly if you have a medical problem, you should be able to see your family doctor within a day or two or three, and that's what you should be expecting from your family doctor. You always have the option of going to the walk-in clinic. You don't get penalized for going there. There's no reason you can't go. But your family doctor should be able to see you if there's a problem that's urgent.
まあ、予約を早めないといけない理由にもよるんでしょうけども、まあ、医学的にね、そういう理由がある場合は当然ファミリードクターはそれにリスポンドする義務があるんでね、まあ、どうしたらいいか、まあ、それは基本的にきちんとその症状なり何なり話すしかないし、まあ、エマージェンシールームに行くっていう手もあるし、次にアージャントケアの施設の話も出てきますけども、まあこれはちょっと一概にはなかなか答えが出せない、いろんなサーカムスタンスがあると思うんでね。
So, as I mentioned before, there is no limit for how many times you can see your family doctor, especially if you feel that you weren't properly understood or you didn't communicate the problem well enough. So the only thing you're limited by is the number of appointments your family doctor has available. So, I mean, as a family doctor, frequently I have patients who have a particular problem and we're working on it, and we try something, and if it doesn't work or their symptoms change, then I expect to see them again in a few days or a week to tell me that things aren't better or my symptoms are changing. So there's no limit for how often you can see your doctor about even the same symptom. And you know, one of the things we want patients to do is to advocate for themselves, and if they feel their problems are not getting addressed or their symptoms haven't improved, I always tell the patients I want to hear about it. When I see a patient and give them either a prescription or a treatment or recommend something, and I don't hear from them, I assume they're better, but I would like to know if they're not, and the only way I can know is if they either call me or come in to see me.
まあだからこれに対する簡単な答えはイエスということですね。何回予約取っていってもいいし、 何の理由であれもう一回言ってもちろん構わないと。患者さんとお医者さんの関係っていうのは人間関係だから、なかなかその医学単純に医学の問題だけじゃなくてあるんだけども、これは制度的にはこれは何にも問題ないと。同じ問題でまだかかるのはこれは何の問題もありません。
So for a second opinion from a specialist, as we talked about before, go back to your family doctor, say, look, I'm not entirely happy with what this specialist says, or I don't think he understood what I was saying, or I didn't like him. And your family doctor, unless it's a very trivial reason or a misunderstanding, there should be no problem with getting a second opinion from a specialist. As far as a referral from the family doctor to see another family doctor, you might not get that, but you don't need any referral to see a family doctor. So if you are not happy with your family doctor, the same way we talked about finding the family doctor originally, just find another one. I should mention that family doctors, there are two systems in which family doctors in Ontario get paid. One system, which is the older system, is that patients come to the family doctor. Any patient comes in, the family doctor sees the patient, bills OHIP, and OHIP pays them. And that system is still widely used. It's what's used at all the walk-in clinics. However, a lot of family doctors are switching to another system which is called a capitation system, which means the doctor gets paid only a very small amount for seeing the patient. They get paid for enrolling a patient in their clinic. So you go find your family doctor, and the family doctor says, would you like to join my roster? And again, it costs the patient nothing. The patient signs up, and then from that point, that patient is on that doctor's roster. The doctor gets paid to look after that patient, whatever it takes. Again, there's a very little token amount that gets that the doctor gets for seeing the patient, but most of the way the doctor gets compensated is for looking after that patient for whatever they need and having them signed up on the roster. So if you want to see another family doctor, it's a very simple process. Find another family doctor. They may, if they're on that system, say, okay, now that I'm looking after you, you can sign onto my roster, and they get taken off the original doctor's roster.
セカンドオピニオンのスライドが書いてあるんですけど、もし紹介された専門医のが気に入らない、あるいはセカンドオピニオンが欲しいという時は、その元々のかかりつけの先生とか行って、次の違う専門医に紹介してもらうというのは、それはもちろんいいわけです。何の問題もない。あとは家庭医の先生をスイッチしたい、かかりつけの先生を変えたいという時は、新しい先生を見つけてそこへ行くのがもちろん手っ取る場合、紹介いりませんからね。あるいは、さっき見せたようないろんな方法で見つけて、その新しい先生とかへ行くと。で、その先生から前の先生のところに言ってもらって、必要な何かレポートの記録なり何なりを送ってもらうということはもちろん可能だ。それからオタリオのその家庭医の先生のシステムって2つあって、患者さんの方からすればあんまり大きな違いはない。もちろんお金どっちも払わないんですからね、OHIPがカバーしてくれるんで。ただ一つはその日本と同じ出来高払い、旧来のシステムで患者さんのを見て、それに応じて家庭医の先生が OHIP に請求して診療医療費が降りてきてっていう格好の場合と、もう一つはそのロスターっていってその名簿を保持してて、これが私の患者さんですって名簿があって、その人が自分のところ、その人の面倒を見て、その人が自分のところに来た時には、若干それでその OHIP に請求してお金をもらうと。だからロスターに入れるということで OHIP からお金をもらえてっていうことになってるんですね。イギリスのシステムに近いのかなと思うんだけども、だからそういうシステムであれば単にその電話かけてこっちの先生のロスターから外れて新しい先生のロスターに入れてもらうっていう格好になるわけですけども、家庭医を変えるっていう場合にはそういうふうにして、とにかく新しい先生を見つけて移っていくっていうことになるかなと思います。
すみません、よく分からなかったので、このロスターが入るこっちにはどう このロースターから外れてこっちに行くにはどうすれば。
その今までの先生のところにね電話でも何なりして外れて新しいとこ行きたいんだけどっつって、そしたらそこでもうロースターから外れますよね。で新しい先生のところへ行ってあなたの患者さんになりたいっていうことでそこのロースターに入れてもらえる。
その元々のファミリードクターが新しい先生紹介してくれる。
いやいや自分で探さないといけない。
自分でそうすると新しい先生が OK, you join the roster。
そういうことです。
それでやっぱり自分の間違ってた元の先生に戻りたいっていう時は
そうしてもちろん構わないと思いますよ。
でも先生ご機嫌悪いですよね。
それは人によるんでしょうね。それは人によるんだと思いますけど、でも正直に話せば分かってもらえるんじゃないでしょうかね。
私こういう経験があったんですけどね、6ヶ月間unattended. I had pains all over my body. Every morning I woke up, my body was like a statue pasted by cement, could not move. And then my pain moved from right to left, and then left, the neck, shoulder, and then back, the legs, knees. Every time I phoned, the nurse intercepted, and they said, "Oh, the doctor is busy, or doctor is not in today." And then I had so many blood tests, and then they all said, including doctor said, "Nothing is wrong. The blood test showed nothing wrong. And if you have pain, why don't you take Tylenol, the extra strength?" And then so I started to take 750 aspirin every day. And then it lasted for a few hours, and then I still had pain. And then I called so many times, and then I became a nuisance. And the receptionist, when I go, they say, "Oh, here comes the problem," kind of face, I can read it. And then finally, the stranger asked me, "Are you all right?" When I was walking, I could hardly walk. And then finally I listed all the things and the date, and I took to the family doctor, and I said, "Look, nobody would say nothing is wrong with me. Look at me. I could not even put my feet in the shoes. My ankles swollen up, my legs, I could not bend my knees." And then for the first time, she referred me to a rheumatology specialist. I have been asking to refer me to a specialist. I have been asking and asking. Nothing happened only because it's not proven clinically and something is wrong with me.
いろんな方いろんなケースっていうか経験をお持ちだと思うんだけども、個々のその患者さんとねお医者さんの関係についてなかなか一般的な話することは難しいので、会が終わってからもしお話しいただければいいかなと思うので、いろいろ他にも話したいことがあるものですから、それでよろしいですか？
すいません。はい。ファミリードクター。
ファミリードクターのそのロースターに加えてもらうので、複数のファミリードクターのロースターに加えてもらうっていうのは制度上可能なんですか？
Is it possible to put yourself in multiple family doctors rosters?
As soon as you sign up to a roster, the government automatically takes you off any other roster that you're on. So it's only one at a time. And you're not allowed to switch. I think there's a rule that you can't. So if you're on a roster and then you switch to another family doctor, go to another roster, you can't make another switch for 6 months.
すみません、知らなかったんだけども、6ヶ月はだから受けないということですよね。おヒップでモニターされてて、どっかにサインアップしたら、他のところのが消されちゃうんですよね。
ということは、だから自分でその以前のファミリードクターに連絡する必要はないという。
So they don't need to let the previous doctor. だから変えた時点で自動的に消えちゃうんで、すみません、連絡する必要ないんですね。電話して自分のロスター外してくれって言う必要もない。新しいところ行って、そこで登録した段階で他のレジスターされたものが全部消えちゃう。
Yeah, once a month we get a printout of a list of all our patients on our roster, plus a separate printout of changes. So patients that have left our roster, new patients that have joined our roster. So that's sometimes we don't find. If a patient of mine moves away to a different city, sometimes the only way I find out about it is that I see that they've been taken off my roster and have joined somebody else's.
よろしいですか?
Number 9. So, as I mentioned before, so how to change your family doctor, we talked about that.
Okay.
So, again, you don't have to go do anything special, just find another family doctor. Right. Now this one. Okay, so as I mentioned, you cannot see a specialist in Ontario unless you have a referral from a family doctor. Sometimes you could just call your family doctor and say, look, I've got this minor problem and I need to see the dermatologist. Usually you have to go in to see your family doctor. He has to assess the problem, decide which is the appropriate specialist, and then he or she makes the referral to the specialist. Frequently I'll get patients say, I need to see this doctor because I have this problem. My friend went to see this doctor. Can you send me to them? And I will know that that doctor is not the appropriate doctor. Maybe that doctor, for example, if the person has a knee problem, maybe that's an orthopedic surgeon that only does shoulders, and the patient may not understand that. So there's a reason why you have to go through the family doctor. And one of my jobs as a family doctor is to assess how serious a problem it is and how urgent it is. There's certain things, for example, if I need to send somebody for a screening colonoscopy to check for bowel cancer, just for preventative care, I know that it doesn't really matter if that colonoscopy is 3 months from now. However, if somebody's having bleeding, then I know I want them seen within a week or so. One of my jobs is, if I see that and I make a referral, and I see the appointment is going to be far away, I pick up the phone and I call the specialist and say, look, this is my patient, this is the problem, you have to see them sooner. That's one of the jobs of the family doctor. And that's one of the things you should discuss with the family doctor. If they're going to send you to a specialist, get an idea from the family doctor how urgent the problem is and when you should expect to get an appointment. Because certain things are not appropriate in terms of waiting.
専門医に行くには紹介が必要だということですね。そこが日本とはだいぶ違うところなのかなと思うんだけども、あと緊急の程度によって、見てもらえる待ち時間が短く、すぐに見てもらうようにすることも可能であるということですね。
Okay, so same thing. So if you have a certain specialist in mind, ask your family doctor. That's what, you shouldn't, first of all, you should never feel shy to ask your family doctor anything you're concerned about. Either a referral to a specialist or whether you need a referral, why. So if you have somebody in mind, ask the family doctor. The family doctor will tell you if it's appropriate or not, and you can make the referral if it's necessary.
だから簡単な答えはイエスということですね。特定の専門の方に紹介してもらうことは可能です。
So question 11, we just talked about that. If you're not happy about the waiting time, speak to your family doctor. They can explain to you if they think it's at a reasonable length of time, the family doctor will tell you. If it's not a reasonable length of time, then the doctor should know. Sometimes I make a referral, my secretary has arranged the appointment with the patient, and I don't know when the appointment is. So if you think it's too far off, call and speak to the doctor or come in, and then we can see if it is appropriate or not.
まあだからファミリードクターに再度掛け合うっていうのが一番合理的な手段かなと思います。
So, you know, as a family doctor, we have several roles. One of them is to make sure our patients stay healthy, make sure their medical needs are met, but we're also, in a sense, gatekeepers. So, if I believe somebody comes in and wants a referral to a specialist, and I believe it's not appropriate or it's unnecessary, it's my job to explain it to the patient and for them to understand why. Now, there's certain times where it's not clear-cut, and you'd say, okay, look, to be on the safe side, we will send you to a specialist. There are other times where it's clearly not indicated, and frequently the specialist won't even take the referral. We send a referral into the specialist. They may say, this isn't appropriate, we don't need to see them. So there are different opinions that should be discussed.
まあこれも一概に答えを言えないんで、ファミリードクターと何回も相談するしかないかなと思うんですけども、まあ状況によるんだけどもファミリードクターを変えるっていうことも一つの方法かなと思いますけども、やっぱりその医学的な知識のある方と相談してその上で判断してもらうしかないんじゃないかなと思います。
Okay, so the emergency department. So if you need to see go to the emergency department, you can go there. The website here tells you where your closest emergency department will be. If you need an ambulance, you call 911. That's how you get the ambulance. If you're unsure whether this is a problem that requires the emergency department and you don't want to take a chance, you can always call that number we gave before for telehealth and speak to one of the nurses at telehealth, and they will tell you, well, yes, you should go to the emergency department, or no, this sounds like something you can wait till morning or the next day.
さっきお見せしたテレヘルスなんかで相談してから考えるという手もあると思うんですけども、一般的には直接電話か救急車を呼ぶかということになります。その際には症状のみを伝えればいいんで、オヒップのカードとかなんとかでそんなこと気にしないで、緊急の場合もありますからね、症状のみでいいと。
At the emergency department, be prepared for long waits. I think the average length of time that patients wait in the emergency department is about 4 or 5 hours. But patients are triaged. More serious patients, chest pains, strokes, things like that are seen immediately. If you come to the emergency department with a sprained ankle or a cut, you may have to wait several hours to see a doctor, and that depends on how serious your problem is, what time of day you're going, how big the emergency department is, how many doctors they have on staff seeing patients, whether there's an outbreak at the time. If there's a flu epidemic, you can imagine that the emergency department is a lot busier, and it may take longer before you're seen.
エマージェンシーデパートメント行けば軽ければ症状が軽くてあんまり問題が深刻でなければかなり長いこと待たされるし、見てもらう前に帰っちゃう人もたくさんいるから、その辺はそのタイミングとかいろいろよると思うんですけども、症状が深刻であればすぐ見てもらえる。それは間違いないです。
There is a particular type of center in Ontario called an urgent care clinic, which is sort of one step down from the emergency department. These are outpatient clinics, so usually there are problems that will not require admission to the hospital, where you won't have to stay over, but they can handle most minor emergencies like cuts, broken bones, eye injuries, fevers, burns. You shouldn't go there really if you have chest pain or you think you're having a heart attack, or if you think it's something that's going to require admission. And it's the same idea as the emergency department. No appointments required, covered by OHIP, and how long you wait there depends on how busy they are.
エマージェンシーデパートメントっていうのはその心筋梗塞だとか脳卒中だとか とにかく緊急性の高い重篤な人を扱うためにあるもので、そのエマージェンシーの中にね、軽いものを扱うサブセクションみたいなのがあることもあるけども、このアージャントケアセンターっていうのはその軽いものだけを中心に見るもので、いくつかそういう施設があります。症状というか問題扱うものとしてはこういうものがあると。でだからこういうところは逆に今度重症なものを扱わないんで、いや胸が痛いだとか脳卒中みたいだなんていうのはこんなとこ行かないわけで、エマージェンシーデパートメントに行くわけですけどね。アージャントケアセンターっていうのもあるということです。
And the website up here lists where there are urgent care centers in the city. As we mentioned before, dentists, you don't need a referral. You can just call up your local dentist, make an appointment, but there is no coverage for by OHIP. So dental care can be very expensive. Some private insurance plans will cover dentistry, some won't. You have to decide which one you want, or whether you want private insurance or dentistry at all.
歯科医療は OHIP はカバーされないので、プライベートインシュランスでカバーするしかない。紹介はいりません。ただ最初に言ったように、病院でやるような大きな歯科の処置っていうのは OHIP でカバーされるということです。
We covered this already. You don't need a referral to an optometrist. If you need to have your prescription for your glasses checked, you can self-refer, you can book your own appointment. But remember, unless you're under 20 or over 65, you'll be charged for it.
検眼師さんのことは先ほどお話ししました。
Once again, you don't need a referral for a dentist or an optometrist. Sports doctors are usually family doctors, so just like family doctors, you don't need a referral. Midwives, you don't need a referral either. Midwives are covered by OHIP. And it's, as we'll talk about in the next slide, it's a personal choice whether you see an obstetrician, a family doctor, or a midwife. All covered by OHIP, although the obstetrician, you will need a referral to see them.
日本で一般に言う産婦人科医っていうのはオブステトリシャンって言ってますから、これはファミリードクターからの紹介が必要だと。でファミリードクターの中にはお産を手掛ける人もいらっしゃるので、その場合はその人がお産をあれしてくれると。で助産師さんはもちろん紹介いらないけど、この全てをOHIPでカバーされると。あとは妊娠と出産に関するこれは情報が載ってる、ここのウェブサイトに行けばいろいろ情報があると思います。次に質問がいくつか載ってると思うんですが、スライドに出てこない質問でもあれば受け付けますのでしてください。
And you should realize that most family doctors and obstetricians who do deliveries are in on-call groups. So just because they looked after your pregnancy, if you go into labor in the middle of the night, they may not be the doctor that delivers you. It may be one of the other doctors in their on-call group.
お産の性質にもよるんで、かかりつけの産婦人科の先生であっても、そのグループで当直になっていることがあるんで、実際にお産になった時は違う先生が扱うということがありますから、それは覚えておいてください。
Regular checkups for cancer detection and gynecological examinations is part of the regular family doctor's job, so you just book an appointment with your doctor.
医学的に価値の証明されている何ですか、検査、人間属的な検査っていうのはOHIPでカバーされるんで、かかりつけの家庭の先生にアレンジしてもらってやるということになります。たださっきプライベートクリニックでやってるような、例えば何の症状もないし疑いもないのに、例えば CT スキャンやるなんていうのは、そんなのは医学的にその価値が認められてないんで、自分でお金払うわけにはいいけども、OHIP ではカバーされてないのでね、それは全く別の話になる、そういうことです。
For allergies, you start off with your family doctor. Sometimes it can be treated with simple medications, eye drops, nasal sprays. If necessary, if we have to find out what particular things you're allergic to or if it's not behaving the way we expect, then the family doctor will refer to an allergist, an allergy specialist.
アレルギーの診断治療っていうのはファミリードクターのところで済むのが一般的で、なんか特別なアレルゲンであるとか、なんか特別な場合っていうのは、そこからそのアレルギーの専門家に紹介してもらうようなことになるのかなと思います。食事、そういうのっていいや、advice about diet.
Oh, okay. So dietitians are not usually covered by OHIP, but there is a service in Ontario called Eat Right Ontario. They have a website which is www.eatrightontario.ca, and there's a phone number that you can call, and they will give you free access to a dietitian, either on the phone or by online chat. You can ask whatever questions you want, totally covered by OHIP.
これは OHIP でカバーされるアクティビティで Eat Right Ontario だから Eat 食べるの Eat に Right 正しくで Ontario は一つの言葉になってますけど eatrightontario.ca で1877 510 is it 510? 5102 OHIP カバーの、栄養士さんによる指導が受けられるということです。eatrightontario.ca.
So, for an anaphylactic reaction, so two things. So, first of all, if you're really having an anaphylactic reaction, if it's true anaphylaxis, you should be calling 911 and getting to the hospital. EpiPen is used if you're having shortness of breath or difficulty swallowing, and an EpiPen is not a treatment. An EpiPen, the only point of the EpiPen is to make sure you don't die before you get to the hospital. So, you use the EpiPen, call 911, and get to the hospital. Then, it's got to be determined what the anaphylactic reaction was to. So that's at a later date, after the anaphylactic reaction is over. Frequently referral to an allergist is where you would go next.
But oftentimes they don't have EpiPen around.
If they have no idea if it's the first time, you're right, call an ambulance. If it's a true anaphylactic reaction, which means trouble breathing or trouble swallowing, don't take a taxi or Uber. Go get an ambulance.
アナフィラキシーショックっていうかアレルギーがはっきり分かっててエピペンっていうそのエピネフリンの注射器持ってる人っていうのは分かってるから、それはいいんだけども初めてだったら分かんないですよね。だからその危ないアレルギーの症状っていうのは例えばなんか薬飲んだりなんか食べたりして本当に1時間か2時間の間に起きるようなもので単にこのじんましんができるんじゃなくてこう息ができなくなってくるそこが一番問題になるんで単にこうじんましんがちょっと出て赤くなるとかですねそれは待てるんだけども息が苦しいっていうのが危ない症状だからそういう時は救急車ですね。
質問よろしいです
か。はい。
紹介状のことについて質問がありまして、これから来る日本の家族が、持病がありまして一応念のためにそのかかりつけ医に紹介状を書いてもらおうと思ってるんですがそういう紹介状がそもそも必要なのかもしくはその紹介状があればいちいちファミリードクターを通さないで専門医の方にいきなり見てもらうことも可能なのかどうなのかということをお聞きしたいんですけども。
いや、やっぱりファミリードクターに持っていかないとダメですよ。
最初にファミリードクター
なんか個人的なその日本の先生とねこっちの専門医の個人的なつながりがあって、はい、ただなんか特別でもここのファミリードクターにまず行ってみてくださいなんて言われるかもしれないけど、原則的にはファミリードクターにそれを資料を持ってって紹介してもらうということになると思います。
わかりました。ありがとうございます。紹介状あった方がいいということですか。
やっぱりもうその事情にいろいろよると思うんですけども、何かちょっと込み入ってるんであれば紹介状があった方がいいと思うんですが。
わかりました。はい、ありがとうございます。
Okay, so we talked about medicines before. They're not covered by OHIP. If you think that you're going to have significant drug costs, then it probably makes sense to have private insurance to help pay those costs. I made a note here that it's worthwhile to go to the same pharmacy for all your prescriptions. And again, there's no rule about that, there's no law about it, but the pharmacist can check to see whether they'll know which other drugs you're on, make sure there's no interactions, see how often you've been refilling. So it's always a good idea to keep to one pharmacy. In terms of prescription refills, depending on the type of medication, that's going to be up to your family doctor to decide how many refills they give you for things that you've been on for a long time and are stable, like blood pressure medications. There's no reason why the doctor can't give you a year's worth of medication at a time. Frequently, the pharmacy will only give you 3 months at a time, but the doctor can put several repeats. And it's also up to the individual doctor to decide how they handle repeats. If you run out of your medication and you call the pharmacy can contact the doctor and ask for a repeat. Some doctors want patients to come in for a visit to make repeats. Other doctors don't care and will just say fine. They'll either fax back an okay about the repeats.
ここに書いてある通りなんですけども、まず最初は薬は大ヒップではカバーできないんで、自分の保険でカバーすると。で、薬局はどこでもいいんだけども、処方歴が残るんで、一つのところ決められといたらいいかなと思うんですけども、で、あとはリフィルって言って同じ処方を繰り返す、だから疾患にもよるしね、薬にもよるんで、まあ3回1年間ぐらいカバーするぐらい、3×3、9ヶ月近くカバーすることもできますけども、まあそれでなくなっちゃったらどうするか、まあそれは病気にもよるし、薬にもよるんで、かかりつけのお医者さんと相談して、まあそのまま継続の場合もあれば、もう一回来てみて、なんか検査して変えるなり、そのままで決めてまた続けるっていういろんな場合があるんで、それはちょっと一概に言えないということですね。あとちょっとさっき言わせれたけど、紹介上ね、例えば薬の重篤なアレルギーだとか、なんか大きな病気の治療歴だとかね、そういうようなものは絶対紹介状があった方がいいと思うんですけどね。続いていくつか質問に答えるセクションに入りますけども、薬のことで今のこのスライドに関して何か聞きたいことありませんか？では、じゃあ、どうぞ。
すみません。すみません。OHIP でのカバーなんですけど、処方箋というのはカバーされるという認識でよろしいですか？
The prescription itself is covered.
Yeah, so the writing the prescription is covered. Yeah.
だからドクターのオフィス、病院の中で起きることは全てカバーされてるんです。
すみません、ありがとうございました。
So number 70.
So we could talk an hour about what should be at home. It depends on what type of medical problems people have. Depends whether there are children at home. Depends on a whole bunch of things. You know, I don't think that there's a lot of things that have to be kept at home. Pain relievers like Tylenol or anti-inflammatory medications like Advil, something to put on cuts and scratches like an antibiotic cream like polysporin. But beyond that, I think most things can wait until you need them and you can go to the pharmacy to get them. But, you know, people will usually need an analgesic pain medication and something for cuts and scrapes, but nothing more than that.
まあ解熱鎮痛薬あればいいんじゃないですかね。置いといて小さい子がわけわからんで飲んだりしたら困るからね。だから薬なんてあんまり家にない方がいいとは僕は個人的には思ってんだけど。
That's an interesting question. I don't know of any groups of medications that affect Japanese children any differently than Canadian children. There are certain diseases and conditions that are more common in Asians than in North Americans, but in terms of big racial differences in drug effectiveness, I haven't heard of that for any medications actually.
簡単に言えば注意するべきことはないということですね。同じですね。日本人の子供が、何かの病気でこの薬が必要で、人によってこのぐらいの少ない量からこのぐらいの多い量までで平均がこのぐらいでということになれば、例えばこっちの白人の子供たちはこの辺から始まってこの辺で少しずれてるけどもっていうぐらいなもんで重なってる部分の方が多いんでね、量が多い少ないあんまり気にする必要はないし、こちらで処方されている通りに飲んでればいいと思います。
Certainly there are certain drugs that work better for children and differently for adults besides just the dosages. But that's pretty specific things, depend on the specific illness and the specific type of drug that's being used. In general, that's going to be the job of the family doctor to know that. It's sort of beyond the scope of what we can talk about here, but yeah, there's certain drugs that work better for children and certain drugs that work better for adults.
薬によって違うんで一概に議論できませんからあれなんですけど、子供に適切な投与量っていうのはだいたい6歳から7歳の子供が大人の成人の半分ということだけ覚えておく。成人の薬であれば半分と。1錠だったら半錠ってことですね。ただ子供用の違う薬が剤形があればそれはもちろん使いますけどね。だからそこを覚えておくぐらいで、あとは薬によっても違うし、大人にかなり近い量まで使うこともあるし、様々なんで本当にケースバイケースです。
So there are some differences between generic drugs and brand name drugs. When a company makes a generic drug, they have to prove that their drug has at least 80%, I believe it's 80% of the activity of the brand name drug. Now for the vast majority of drugs there is no difference. There are some drugs where there are slight differences. Your family doctor should know which ones they are. In general though, as a usual rule of thumb, using a generic drug is acceptable. Your doctor can write on a prescription no substitution, which means they can insist that you get the brand name drug. The only exception is if you're getting your drugs paid for by the government. If you're over 65 or on one of the drug plans that the government runs because of low income, they have a right to substitute generic drugs for the brand name drugs because it's cheaper. So usually I would say the short answer is there's not a big difference. Sometimes there is. If it's something that's a concern to you, you can ask and you're willing to pay the extra amount for the brand name drug, you can ask your doctor to make a notation on the prescription and you will get the brand name drug.
先発のブランドネームの薬から後発のジェネリックに変えるときに効きが悪くなったりなんかそういう恐れはないのかという話なんですけども、同じブランドネームの薬飲んでたってバッチっていうか工場で作って新しいのを作ってくるわけですから、それによってある程度のふらつきはあるわけでね、それを超えてさらにこういうふうにふらつくのかどうかっていうことなんだけども、それは一応規制当局が厳密な審査してそういうことはないということで許可しているわけなので、あんまり大きな問題はないと。ただそれも一概にはなかなか言えないので、それもやっぱりケースバイケースで家庭医の先生と相談するしかないし、もし医学的に変えられないっていうブランドネームこの薬からこの薬同じ成分だけども変えられないっていうようなことがもし医学的に、した方がいいっていうことが認められれば、それは家庭医の方からかかりつけの先生の方から薬局の方にこれはサブスティテューとか変えることはできませんっていうことになって、高い薬でも使い続けるっていうことにはなるとは思うんですけども、原則的にはこれは変更可能っていうふうに考えておいていただいていいかなと思います。で、次予防接種に入る前に薬のことで何かお聞きになりたいことありませんか？なんか聞き忘れたことがあればまた最後にどうぞ。
Okay, so immunizations. There's a whole list of immunizations, a lot of them for children. all covered by the government, almost always given by the family doctor. Of course, it's very useful if you're coming here from Japan to have a list of your child's immunization record. I am sure that the immunization program, the schedule is not exactly the same in Japan as it is in Ontario, and it has to be looked at to see which immunizations have been given and which immunizations haven't, and arrangements can be made to catch the child up or make sure that everything is up to date. Flu shots can be given by the family doctor. It can be given in a public health clinic, which the government runs every October to January. Flu shots are now also given at pharmacies during that same period of time. Any other immunizations besides flu shots and the regular immunizations the government has recommended are not covered by OHIP, usually given by a family doctor, or if they're travel immunizations, there are travel clinics where you would go to and pay to have these shots given.
まあ、この表は一目瞭然で特に疑問になるところはないかなと思うんですけども、いいですか？ウォークインクリニックは、あるいは薬局って、インフルエンザはあれだけど他のはできないということですね。
So, in order to enter preschools or school, the law is that children have to have a certain set of immunizations. That's just to protect all the other children from outbreaks. So there's a whole list of immunizations that your family doctor has. And when you enter your child into school, they will ask for the immunization record, and it's got to be up to date. Your family doctor can give the immunizations that are missing. Also, the City of Toronto Public Health Department offers free immunizations at clinics to catch children up so that they can enter school. And that's anywhere from grade 1 to grade 12. And the website for finding where you can book an appointment at one of the clinics for free immunizations is on the slide.
学校、幼稚園に入るのに進むのには予防接種のスケジュールこなしていることが求められるので、それは、もちろん皆さんご存知だと思います。Do they recognize the immunization record done in other countries?
Yes, so as long as there is a record of having had those immunizations, you're given credit for it. As long as they're given at the appropriate time and the child has had that, then
だから日本での予防接種の記録が、もちろんきちんとされてあればそれは考慮してもらえるっていうことですね。それはいろいろ当局者によって違うのかなという気もするんだけども、認められるはずです。スケジュール。
Okay, so this is complicated. It's complicated even for doctors. You can find online the list of immunizations that are required for children, or that are recommended for children. It's very complex. It changes year to year. If there's any doubt, you can either call public health, or take your child to public health, or take your child to the family doctor, and they can determine whether they're up to date with their vaccinations. But I don't think you have to worry. And if you've taken your child to the family doctor, leave it up to them, because like I say, it's very complicated, and some shots have to be given at a certain time, and some shots are necessary for school. But if you want to see which shots are necessary, it's on this at the website here.
オンタリオ州政府の厚生省のウェブサイトにスケジュールが出てますから、ただいろんな公衆衛生上の事情によって更新されたり新しいのが入ったり抜けたりということがあるかもしれないので、これを参照していただければいいかなと思います。全体的な印象としては日本よりはカバーの範囲も広いしきちんとしてるかなと。なぜか知らないけどパピロームバイラスが日本で副作用が出てどうのっていう問題はなんかこっちでは全然聞かないし不思議だなと思ってるんですけども、こっちの方が広範囲にされてるオンタリオの方がねかなと思います。で次に最後に3つ質問が出てるんですけども、これにお答えして、あと何かどの項目でも構わないので聞き残したことがあればまた聞いていただきたいと思います。So 3 questions.
Okay, so So the reason why there are differences between Canada and Japan has to do with two things. First of all, there are differences even between Ontario and Manitoba, Ontario and Quebec. So partially it has to do with how prevalent certain diseases are in a particular area. Secondly, it has to do with political things, how much the government's willing to pay, what the laws are. So, for example, BCG in Canada, there's two ways of dealing with tuberculosis. One is to immunize with BCG if it's very prevalent. The other is not to immunize, but to look for evidence of TB by doing TB skin testing. It's just a question of how prevalent the disease is in the different jurisdictions. The rest of it has to do with how much money the government's willing to put into each individual program. And like I said, there's no right and wrong here, and sometimes there's differences between different provinces.
同じカナダ国内でもその州によってね、スケジュールが違ったりすることがあるので、日本とカナダの予防接種の項目の違いはなぜ起きるかというと、一番簡単にはその対象とする疾患の発生頻度が多いか少ないかっていうことが一番だろうと思います。結核なんかはね。だからこれもその今こうやって話してるけども、10年後、5年後、10年後にはこのままかどうかっていうのはまた別の問題なんで、ただ今言えることはその対象とする疾患の、頻度が違うからっていうふうに覚えておいていただければいいかなと思います。
So as I mentioned, the vaccines that you get in Japan will count as having had the vaccines. There are some vaccines where it doesn't make a difference how many times you get them. There are some vaccines where it's not good for you to get them if you've already had them. Usually those are some of the vaccines later in life, like the pneumonia vaccine, some of the measles, mumps, and German measles vaccines. But in general, nothing bad will happen if you get it more time than necessary. But if it's not necessary, we shouldn't be doing it.
これも先ほど言ったように日本で同じ予防接種を受けたからどうか何か問題が起こるってことはないんでね、それは問題ないですけども、日本できちんと受けていればそれは考慮されるはずなんで、そのレコードをきちんと示してもらって、話を聞いてもらったらいいのかなと思います。で、最後の質問は。
Okay, so voluntary vaccines. So first of all, everybody should understand that except for school-age children, all vaccines are voluntary. You never have to have any vaccines after school if you don't want to. I think the question is not so much voluntary vaccines, but non-paid-for vaccines. So the government continues to pay for regular vaccines for adults for tetanus, diphtheria, and whooping cough. It pays for a pneumonia shot at age 65. But there are other vaccines that I would still recommend. Things have changed since we did this slide. The human papillomavirus vaccine, which previously we were giving to all girls in grade 8. As of this year, we're giving it to girls and boys in grade 7. If you have young adults who either not sexually active yet or just early in their sexual careers, it's still worthwhile to give the HPV vaccine, the human papillomavirus vaccine, to protect against sexually transmitted human papillomavirus and cervical cancer. The zoster vaccine, up until this year, the government didn't pay for it. They've now announced as of this year that for anybody over 65, the shingles vaccine will be paid for. I would recommend it for people over the age of 60. And the other vaccine that I commonly recommend that's not covered by the government is the meningococcal vaccine. This is given to school-age children who are 12 years old, but probably for children who are, or adolescents who are going away to university and living in a residence with other adolescents, they should have a booster of that vaccine. Plus, there's a new vaccine called Bexsero, which protects against different types of meningitis, and probably 18 to 19-year-olds going away to live with other young adults should get both those vaccines.
髄膜炎っていうのは細菌性の髄膜炎で、ウイルス性の髄膜炎っては全くまた別のものであるんだけども、その細菌性の髄膜炎っていうのは非常にこのワクチンが有効なんで、特に若い、 青年っていうか17、18そのぐらいの人たちだからこれはまあ実費のOHIP doesn't cover it.
Oh, it doesn't cover it.
Do you know how much?
So the it's expensive. $130.
How many shots do they need?
Bexsero, which is a meningitis type B, is 2 shots. Meningococcal Menveo, which is the meningitis type A, C, and W and Y. I think that one's about $70.
One shot, two shots.
One shot for that.
まあ70ドルからまあ200ドルぐらいまでっていうことにはなると思うんですけども、髄膜炎、これは自分で払わないといけない。
And the HPV vaccine for non-school age kids is $150 per shot, and it's 3 shots.
3 shots. HPV、子宮頸がん予防のパピローマバイラス、今グレード7の男の子も女の子も、これは公費で負担して受ける。それの年齢を外れた場合には、150ドル1回でかける3ですから、450ですね。帯状疱疹は、65歳以上はカバーするけども、まあ、川先生の個人的な意見としては、60歳以上ならやった方がいいだろうと。まあ、値段もまあ大体6、70ドルかなと思うんですけど、Zoster virus is 60, 70
No, 110, but as of this year, government will pay for it for over 65.
But between 60 and 60.
$110.
110ドルぐらいだそうです。まあだからこの3つですね。まあさっき言ったように日本でなんでHPV 問題になってるかちょっとわからないんで、これからどういう展開になるかちょっとわからないんですけども、これは今こちらでは必要であろうと思われている一部任意の予防接種の本です。ということで大体駆け足でしたけども、スライド全部説明し終わりましたよね。何か質問がもしこの段階であればお受けしたいと思いますが、どうでしょうか。どうぞ。
歯科についてなんですけど、歯科矯正は大きく適用外だと思うんですが、顎の骨を切らないといけないような手術を伴う歯科矯正の場合は、大きくが適用になることもありますか？
So this is about brace, but if the major surgery is required.
So any surgery, if you need to have dental extractions or jaw advancements or anything that involves surgery that's done in a hospital will be covered by OHIP.
But the associated dental office visit and everything. So だから病院の中で起きることはカバーするんですよね。だから手術って当然病院の中でやると思うんですけども、デンティストのオフィスでやるわけじゃないですよね。だから病院の中でやるのはカバーするけども、その歯科医のオフィスで他のやる細々したことはカバーしないかもしれない。
All this covers the hospital.
すみません、ロースターのことについてお伺いしたいんですけども、これから OHIP を申請しようと思ってまして、でその間は会社の、プライベートインシュランスにカバーされている状態なんですが、その状態でもロースターに加えてもらうということは可能なんですか、それとも OHIP に申請、3ヶ月後でしたっけ、なってからロースターに入るということなんですか。
Before, during the 3-month waiting period for OHIP, he has private insurance. He can be enrolled in one of the rosters.
In order to be enrolled in a roster, you have to have a valid OHIP. So you have to wait until you get your OHIP card.
はい、それではですね、12時40分、2時間40分、77のですね、やっていただきました。本当に先生方もありがとうございました。これにてですね、本日の医療セミナー終了としたいと思います。商工会ではですね、この後9月に今度日本語による交通法規セミナーというのをやりますので、またそちらの方もですね、ご興味お感じございましたら、ぜひご参加いただきたいというふうに思います。場所はこちら、この隣にありますコミュニティルームということになりますが、またご案内の方させていただきますので、よろしくお願いいたします。また本日参加いただきました方にはですね、メールでアンケートの方をお送り させていただきますので、今回のセミナーについてのご評価をいただきたいというふうに思います。よろしくお願いいたします。それではどうも本日はありがとうございました。また先生方もう少しいらっしゃるかと思いますので、個人的な質問などございましたら、ぜひお時間を取っていただけたらというふうに思います。よろしくお願いします。ありがとうございました。